Welcome back, our fans. Inhalation. It is a simple route of drug administration. The drugs delivered through this route have a very rapid onset and short recovery period. Their effect may be rapidly reversed by lowering the concentration of the agent or discontinuing it entirely and administering only oxygen or room air. Nitrous oxide/oxygen inhalation sedation is the most commonly used technique in dentistry for sedation. Nitrous oxide/oxygen, N2O/O² sedation is a combination of these gases that the patient inhales to help eliminate fear and to help the patient relax. It requires special equipment and training. Although it has a wide safety margin, it could prove dangerous and sometimes even fatal at the hands of an untrained individual. Nitrous oxide/oxygen inhalation sedation. Indications. 1. A child mature enough to understand the procedure, usually older than 7-8 years. 2. A fearful or anxious patient but cooperative. 3. Children with special health care needs. 4. A patient for whom profound local anesthesia cannot be obtained. 5. Lengthy dental procedures. 6. Further to the general indications for conscious sedation mentioned previously, nitrous oxide/oxygen can be used in patients with a strong gagging reflex which makes dental treatment impossible, as well as in patients with muscular tone disorders such as cerebral palsy, in order to avoid unintentional movements. 7. Patients belonging to ASA Class 3 and Class 4 can be treated with the help of nitrous oxide/oxygen sedation provided other indications are present, but treatment of these patients must be restricted to hospital settings, where an anesthesiologist can be present. Nitrous oxide/oxygen inhalation sedation. Contraindications. 1. Uncooperative children. 2. Patients with upper airway problems as common cold, tonsillitis or nasal blockage, sinusitis or recent ENT operations, within 14 days. 3. Patients in chemotherapy. 4. Psychotic patients, severe mental disorders that cause abnormal thinking and perceptions. 5. Patients with porphyria refers to a group of disorders that result from a buildup of natural chemicals that produce porphyrin in your body. Porphyrins are essential for the function of hemoglobin, a protein in your red blood cells that links to porphyrin, binds iron, and carries oxygen to your organs and tissues. Advantages of nitrous oxide. Rapid onset, almost equal to that of 4. Administration. Ability to adjust and to reverse. Flexible duration of action. Rapid recovery from sedation. Safe. No injection required. Very few side effects. No adverse effects on vital organs. Patient can be discharged alone. Non-addictive. Dulls the perception of pain. Disadvantages of nitrous oxide. Initial cost of equipment is high. Costs of gas is high. Equipment takes up operatory space. Requires constant patient and cooperation. Chronic exposure of office personnel can cause carcinogenicity, teratogenicity or toxicity. Equipment. The central storage system. Continuous flow design with flow meters. The nitrous oxide tanks are always marked blue for identification, and the oxygen tanks are green. Nitrous oxide oxygen machine. Breathing apparatus. Nasal mask. Efficient scavenger. Procedure. Selection of an appropriately sized nasal hood should be made. Introduction of 100 oxygen for 1 to 2 minutes. Followed by titration of nitrous oxide in 10% intervals is recommended. The typical patient requires from 30 to 40% nitrous oxide to achieve ideal sedation. Nitrous oxide concentration may be decreased during easier procedures, e.g. restorations, and increased during more stimulating ones, e.g. extraction, injection of local anesthetic. During treatment, it is important to continue the visual monitoring of the patient's respiratory rate and level of consciousness. Once the nitrous oxide flow is terminated, 100 oxygen is given for 5 minutes. To avoid diffusion hypoxia, the patient must return to pretreatment responsiveness before discharge. Side effects. Oversedation. Dizziness. Nausea, or vomiting. Fatigue. Headache. Excessive sweating. Restlessness. Remember, The American Association of Pediatric Dentistry recommends minimal exposure to ambient nitrous oxide through the use of effective scavenging systems and periodic monitoring and maintenance of the delivery and scavenging systems. Safety for the staff. Chronic exposure to nitrous oxide has been reported to constitute an occupational health hazard. 1. Bone marrow suppression and reproductive system disturbances. 2. The AAPD recommends exposure to nitrous oxide be minimized through the use of effective scavenging systems and periodic evaluation and maintenance of the delivery and scavenging systems. Thanks for watching. Support us by likes and subscribes.